Hi everyone, my name is Dr. Steve Rios. I'm a pediatric nurse practitioner. Thank you for joining me for your lecture on exercise across the pediatric age groups. So, who am I? Who is this guy that's giving you a lecture? So that's me. My name is Steve Rios, like I said. So I have 8 years experience as an inpatient pediatric nurse on a pediatric step-down unit. I worked at New York Presbyterian Hospital at their Cornell campus. I saw a large variety of things, whether it be neurology patients, respiratory patients, GI patients, everything. We saw everything there. You name it, we saw it. I took care of celebrities' kids, royalty kids, politicians' kids, everything. So we saw a large influx of people, and it was great. I learned so many things there. On the right, you could see that I was a Rutgers University grad, so during 5 of the 8 years that I was working full-time at New York Presbyterian, I went to school part-time to get my doctorate degree in nursing, in which my track was primary care pediatrics, so long word for the nurse practitioner at your doctor's office when you were a kid. And right there at the right, you could see my friends actually found me in a magazine where Rutgers took pictures of me and they were promoting their program. They found me in New Jersey's nursing magazine and sent a picture of me. So this is who I also am. I'm not just who I am at work. I also have my own hobbies and my own interests. So throughout my life, I'm a lifelong martial artist. So on the left, you could see me. That's my garage. I was practicing Muay Thai. I was a Muay Thai practitioner for several years. Slowed down once school picked up, and I couldn't really keep up with training while working full-time and going to school part-time. But I'm a lifelong martial artist. I have my 3rd-degree black belt in Taekwondo. Love Muay Thai. I competed in Muay Thai in the middle. You could see me there squatting. After I couldn't really keep up with training of Muay Thai, I switched to lifting weights, and I found powerlifting, and that's where I found your professor, Alyssa Parton, who's my powerlifting coach, and I fell completely in love with it. That's also my garage there. Went from a full-fledged martial arts gym to a full-fledged pretty much powerlifting gym. And one of my first loves in college is me to the right, calisthenics. That's kind of what got me started with resistance training. I loved calisthenics. Anything that had to do with body weight training I was into. Started with basic movements and went to advanced movements. Like here, that's me doing a human flag off of my friend in the rec room of my university weight room. So my mission. Why am I giving this lecture? What does this have to do with what I do as a profession and what I do as a hobby? So my mission is to merge and bridge the gap between healthcare and exercise sciences. So a couple references here. Nationwide pediatric nurse practitioner programs focus less on physical activity than family nurse practitioner programs and gerontology, which is the elderly. Studies have shown that there is hesitancy in providers recommending any type of resistance training in their primary practice settings, and there's high hesitancy to referring any type of patients to personal training or health clubs, which is essentially a gym. And numerous medical schools report providing some level of physical activity and education in their programs, but the time dedicated to them is drastically low when compared to every single other type of key point that they have, such as topics like nutrition. So they need new and innovative ideas to integrate more into their programs. So that's kind of like the science behind it. These are all studies and research that was found, but more in terms of me and my mission, what kind of happened was I used to be, lifelong weightlifter, exercise. I did the calisthenics, like I had said, and for one point I was like, well, why isn't this working? Something's going wrong. I'm the hardest worker in the room. I'll spend hours in the gym, hours working out. It was very common for me to spend 4 hours exercising when I was doing calisthenics. It was just so fun to be outside. So then about 2 years before I was finished my program, I was like, well, let me see. Something's wrong. I'm not doing it. I need help. So desperately, I hired some random coach who pretty much had no idea what he was doing, and I could tell at some point. I was like, this doesn't seem right. This seems cookie cutter. And I was like, you know what? Let me use the doctorate portion of my program to try and figure out what type of research is out there. And this was shortly after I finished my doctorate project. So I started digging and started doing research and found out the wonderful world of exercise science. And that's kind of how I actually found Professor Parton on Instagram. And I saw that she was one of these science and evidence-based types of people promoting the right type of exercise. So that's where I started exercising on my own. started studying my own and started seeing more progress, and it's where this kind of came about. I started seeing the gap in terms of what primary care providers were recommending when I was at clinical to their pediatric patients. And after I knew all this knowledge from applying it to myself and doing all this research, I realized that there's a huge need for change, specifically in pediatrics, in which how we approach exercise, nutrition, um, working out, sports in this population than what we're actually providing them. So that's my goal, to bridge that gap, to help teach others, teach providers, teach exercise scientists more about the medicine side and teach medicine more about the exercise side and how we could try and help everybody as a whole, all of our pediatric patients and all of our pediatric clients. All right, so this slide is just a cool video about kids and how resilient they are. So the pediatric population is so astounding. Um, it's it's just how much they evolve, right? So kids in general, if you see or show how much they change from the age of 5 to the age of 10, it's drastic, right? You have a kid who could barely hold a pencil and write his name to a 10-year-old who's now playing in competitive sports. You grab that between an age of a 20 and 25-year-old and an adult, or a 35 and a 40-year-old, it's pretty similar. Like the change isn't as drastic. So that's what's amazing with kids, and that's why knowing your age groups is pretty important. So this video is just fun to show how type of uncoordinated kids are, but I also want you guys to see how resilient they are. You could see kids running around and doing some funny things, but look at some of the kids who fall and think about how you would feel if that happened to you or how much harder you would fall. So the pediatric age group, like I said, very resilient, but also ever evolving. And that's what we're going to talk about here in this lecture, how much different they are and how do we attack that? How do we incorporate that into our programming? How do we incorporate that into our coaching and to our talking to the children? And how do we make it something that can stick with them? All right, so before we get started in the fun stuff, the programming, the how to teach, the all that stuff, I want to get into the nitty-gritty. So there's a lot of speculation, or there has been, on exercise, weightlifting, resistance training, the pediatric populations, age groups, a million different things. So what I wanted to do is I want to go over what the evidence says. And, obviously I'm in support of resistance training when done properly. So I just want to help you guys have the proper resources and ammunition in case if there's parents or patients' parents or different types of people who are giving you hard pushback on what you're trying to program for their child or for their students. So there's always a social approach to it, but I'm trying to provide you guys, like I said, with the proper ammunition, the proper education, the proper science and data, so that way you could provide to them like, hey, you could look here, like this is actually very, very safe, and if not just only very, very safe, but highly recommended. And that's what this is here. So first, I want to start off with what the U.S. Department of Health says. So a very large organization, U.S. Department of Health, they released their second edition exercise or physical exercise guidelines in 2018. That was the last one that they did, the exercise guidelines, national exercise recommendations. So key points of what the U.S. Department of Health says. It's to provide opportunities for exercise, provide encouragement, make activities age appropriate, very important, make activities enjoyable, also very important, and provide variety. So they have recommendations for ages 6 through 17, and we'll touch back on the enjoyable, the appropriate, the participation. We'll touch base on that later on in terms of programming, but I just didn't want to leave it out from what the U.S. U.S. Department of Health recommends. So for the recommendations for ages 6 through 17, so just so you guys know, we call this a school age population. Before that, age 3 to 5 is called preschool age population, but for the 6 through 17-year-olds, it's at least 60 minutes of moderate to vigorous activity daily. And there's three types, or at least per the USDOH, there's three types. There's aerobic, muscle strengthening, and bone strengthening. So the majority, they want it to be under the aerobic category. So they want this to be a purposeful aerobic physical activity, higher intensity, 3 days a week. Muscle strengthening, so this is included in the 1 hour or more of daily exercise and should be at least 3 days a week. And bone strengthening should be a part of that 1 hour recommended exercise and should be 3 days a week as well. So we'll touch base on this on the next slide or the slide after that. So we'll go into depth on what this aerobic muscle strengthening and bone strengthening is that the USDOH recommends. But for preschool age, they should be physically active throughout the day to enhance growth and development. Adult caregivers of preschool children should encourage active play that includes a variety of activity types. So what does this mean? Let kids play. Pretty much you want them to be active as much as possible to help create gross motor development, fine motor development, social play, coordination, cooperation, team management. All these different types of things are essential. These are how kids learn. So we want in school to encourage play as much as possible, like recess, gym class, sports, going to the playground, coordinated play in the playground. Some 3-year-olds just play side by side, but 5 years old, they should be able to play some games together, and we want to be able to have them socially develop. If they're going to a baseball class, they're playing, are they going to, or a t-ball class, I'll say. Are they going to be playing a full-fledged t-ball game? Not necessarily, but will they be able to talk and develop in team sports and learn team play and different coordination? Yeah, that's the whole goal. It's to help develop them. We're not trying to create, the next Barry Bonds or Barry Sanders or Mia Hamm by the time they're 5 years old, but we do want to help develop their gross motor skills and their socialization. The benefits. So the USDOH states that the benefits in children aged 6 to 13 is improved cognition, so performance and academic achievements, executive function, and processing speed and memory improve with exercise. And in ages 6 to 17, it shows a decreased risk of depression and reduced depressed mood. All right, so continuing with the USDOH, their guidelines a little bit more explained. So aerobic activity, it's in which the individual rhythmically moves their large muscles for a sustained period of time. So children often do this in short bursts, playing tag for 5 minutes. I remember being dropped off to school, and before they had us all line up, I would play tag with my friends or Foursquare for 5 or 10 minutes. Sometimes or running to go and get your cafeteria lunch. Something quickly like that. Kids are frequently just running and doing quick bursts of activity. It may not be technically aerobic activity, but per the USDOH, for these purposes, they define it as aerobic activity. We also want to make sure it's purposeful, right? So a kid just going on a walk, walking around school, or walking around the mall, that's not activity with them if they're 6 years old. We want to make sure that's something purposeful. Doesn't mean it's not play. It has to be play, or should be play, I should say, like tag. Tag is aerobic activity. Sports, purposeful, play, it's activity. So we just want to make sure that non-purposeful isn't incorporated into that. Walking around the block with grandma, that's activity for grandma, not activity for a 6-year-old. Running around the block with the dog, for a 10-year-old, that's activity. So muscle strength. Muscle strength is increasing the muscular workload more than used during normal daily activity, so also known as muscular overloading. These exercises don't have to be structured and can be incorporated in a part of play. So like how I used to love calisthenics, I used to always go and work out in playgrounds, and kids are always there too. So playground play is a great example of resistance training or muscular strength for the USDOH and school-age children. They can be organized too, so weightlifting, resistance band training, that's completely fine. Same thing for muscular strength as playground play. Bone strength. So bone strength is a force on the bones that can aid in bone growth or bone strength. So it's primarily generated by impact on the floor, and it can be done with aerobic activity or muscle strengthening activity. We'll go more in depth on this in the next slide. All right, so this is straight from the USDOH. This is a table I just pretty much copy and pasted for them so you guys could have it. So there's types of physical activity with the age group. So the muscle strengthening, pretty much tug of war, climbing on the playground, gymnastics for the preschool age. It gets more elaborate in school age and adolescence. So the one thing, these are guidelines, they're not concrete rules. Guidelines are meant to be that, guides. The one thing I would change is that they don't have weight training in school age children. They just add it in adolescents, but they do have body weight and resistance training in the school age children. Um, We'll touch more base on that later. There's other areas and other things I'll touch on. But bone strengthening, hopping, running, gymnastics, jumping. The one thing that they didn't have here, which I thought they should, would be weight training as well. You know, weight training does improve bone density. So that's one thing. Like I said, they're a guide. They're not um, concrete rules, but should be up to. They also should update them soon. You know, it's been a couple years since the last one, so I'm hoping with the next one they do update these and have them with some resistance training in the younger age groups and include the bone strengthening amongst these age groups and aerobic. So these are the million and one things that kids could do for aerobic types of exercise per the USDOH. Like I said, I like incorporating the USDOH because it's a very large powerful organization. You know, if you have a parent who's telling you that they don't want their kid to do weightlifting at 12 years old, well, the U.S. Department of Health says that they can. You know, it's a very, you know, of course, parents always make the rules, but in terms of if they have some worry, it's just like a good trick in your back pocket, something to pull out and say, you know what, this is actually the U.S. Department of Health says it's completely safe as long as there's good parental supervision or supervision of some sort of professional monitoring their activity and their weightlifting. All right, so we're on to our next organization. This is the National Strength and Conditioning Association. So, what do they say about resistance training? Well, before we read over all 7 key points, I just want to see if you guys could just briefly look and see what one key thing is over and over and over. So if you haven't noticed, that one key point, supervise. So everything here says supervise. The one very, very key important part in pediatric resistance training is supervision. You know, kids will do crazy and ridiculous things. So we want to make sure that everything they're doing is supervised, especially with weightlifting, because we want to make sure that they don't hurt themselves. Not saying that a 5-year-old is going to try and bench press 3 plates, but I am saying they might try and throw a 2.5 pound plate up in the air and catch it. And we just want to make sure that that doesn't land on their head. So that's what the supervision is for. They need different supervision for different age groups. So let's go through the steps. This is straight from the National Strength and Conditioning Association's position stance. So they made this article pretty much stating that this is what their entire organization stands by. And it's properly designed and supervised resistance training program is relatively safe for youth. It can enhance muscular strength and power, can improve cardiovascular risk, can improve motor skill performance, and can contribute to enhance sports and performance of youth. Can increase a young athlete's resistance to sports-related injuries. I love that one because a lot of things that you always hear about is, will weightlifting hurt my kid? I'm scared they're going to get hurt. Yada yada, this and that. Well, we all know that resistance training can help prevent injury in adults and in pediatric patients. So this is something that you could bring back to those parents once again, or anybody concerned about why should these kids be lifting weights? I'm scared they might get hurt. Well, with supervision, like I said, every single one of these points has supervision highlighted. With supervision, there's low risk for injury and actually can help prevent other injuries. Point 6 can help improve the psychosocial well-being of the youth. So like how the USDOH said, it helps decrease depression or depressive mood. And resistance training can help promote and develop exercise habits during childhood and adolescence. So habit forming, things that could carry on into adulthood and create longevity in terms of health, in terms of exercise. All right, so our next organization, the AAP, what does the American Academy of Pediatrics say? So this is our gold standard in terms of healthcare on different, not procedures, but policies, different rules, up-to-date research in terms of pediatric healthcare. So I heard from Professor Parton that a decent amount of you guys are pre-med. So if anybody's ever interested in pediatrics, you know, the AAP, they create all the good stuff. They're the gold standard. That and NAP is the gold standard for pediatric nurse practitioners. But the AAP, they create all, like I said, all the policies. They're up to date with all the research. So what does the AAP say in terms of resistance training and pediatrics? So in 2020, they published a position stance on resistance training. So once again, a position stance. So they're putting their foot down and saying, us as an organization, this is what we say. So they also did it with the help of members from the NSCA, which was our Strength and Conditioning Association that I just spoke about previously. So the benefits: muscular strength, muscular power, local muscular endurance, pretty much everything we know, and all the benefits that we know about resistance training. They just highlighted it and stated it just so that way it was there in their position statement. So the next part: evidence suggests starting inactive pediatric patients on resistance training programs improves adherence, which, once in a regimen, can then go to a hybrid program if needed. So I bolded this, but I'll come back to it later on. This is very, very important. So in inactive pediatric patients, resistance training programs improves adherence to exercise, is what they're saying. We'll come back to that, like I said. So this is a chart that I copy and pasted from the AAP's position stance because I thought it was important. So I highlighted the bold ones because they're the myths that we always see. They're more common than the other ones, so we can briefly go over those ones. A child is unable to increase strength before puberty. So there's no point in them lifting weights because they haven't hit puberty yet, and it's not going to help them. So the evidence, what does it say? Prepubertal children are able to gain strength by an increase in neurological recruitment of muscle fibers, and gains in strength can be made with low injury rates if resistance training programs are, what do you think they say? Well supervised. Yep, so there has to be an emphasis on proper technique. And they don't say it here, but proper programming too. We want to make sure they're not being overtrained. Second bold is resistance training may decrease aerobic performance in youth. So if they work out too much and lift too much weights, they might get too bulky. It's not going to help them be able to keep up with track or soccer or basketball. Incorrect. So improvement in aerobic performance has been shown with combined aerobic and resistance training programs. And combined aerobic and resistance training programs do not appear to impair strength gains in children. So the vice versa goes for it too. And resistance training may stunt growth. This is the biggest one. If you lift weights, you're going to stay short. It's going to crush your spine and it's not going to allow it to stretch out and grow. False. Well-designed resistance training programs have not been shown to have a negative effect on physio, which is your growth plate, health, linear growth, which is up and down like a line, and cardiovascular health in youth. And the last one rep max testing is unsafe for youth. So, one rep max testing may be a safe method for assessing muscular strength in youth, provided qualified supervision is present and appropriate testing guidelines is followed. So pretty much proper programming. This kid should not be maxing out every single week under proper supervision. That's not the big brother who's 17 years old and this kid's 12 and they want to, brag about their little brother being able to bench more than their friends. That one rep max can cause injury, but with proper programming, proper pyramidization, one rep max are very valuable to be able to properly track gains, just like in adults. So the key thing that I want to have you guys see here too is these are the most popular myths that we always hear about. And this is the AAP. So this is the organization that these kids' pediatricians go to for the most up-to-date evidence and the most up-to-date research. This is where we get our guidelines in pediatric offices. So if we're having those concerns while programming for a kid, or we're a coach trying to do some sort of resistance training or weightlifting, once again, and we have people or parents showing concerns and asking us questions, are we sure that it's okay that my kid could lift weights? This is one of those things, this is that ammunition that I'm here to provide you guys, showing, what, like, if the guys that your pediatricians go to for the most up-to-date evidence, those guys, that organization, they actually recommend that under good supervision, it's actually recommended. So, and all those myths were debunked. All right, so continuing with resistance training, because it's the current topic we've been talking about. We spoke about the good. So what about the risk? What could be the bad part about it? So there's risks of overtraining. Lengthy training with heavy loads without proper recovery is associated with injury and illness. Same thing that goes with adults. This isn't something that we didn't know about, but it's important to highlight this because a lot of, I said kids are resilient, but that doesn't mean that they're invincible. So we want to make sure that we're not putting them in harm's way by overtraining them. They can be very resilient, but they do break. Resistance training requires attention similar to that of different forms of exercise to avoid overtraining. It's important to account time spent in resistance training as part of a total training time to reduce the risk of overuse injuries. So, for example, we have a tennis player. If we have somebody who's playing tennis and we are drilling, or their coach, it's not specifically us, in practice, is drilling serve strength, power. They're going through power over and over and over and over again. It might not be in the best interest for us to incorporate shoulder or some sort of like overhead movement for 1 rep max or overuse or volume training that week, right? That might be a good week to say, they're overtraining the serve and strength. Rather than continue to train that, let's pivot to leg strength or balance or pivoting or hip motion or explosive hip pivots, something like that. Um, I'm not a tennis athlete, so, I don't know if those hip movements are the most important part, but that was just an example for trying to avoid overstimulating or doing overuse and causing overuse injuries for that type of client that we may have. So, as their strength and conditioning coach, and when you're doing the programming, you want to make sure that you know what's going on in their actual training, their sport specific training, so that way you don't cause any injuries. For the AAP, continuing forward, 1 to 2 days off per week is recommended. So complete days off. So that means 1 to 2 days of full rest for physical and psychological recovery. I skipped one bullet, so I'm going back to that one. Resistance training program can be done year round, and it could vary in volume of intensity and coordination with season. So just like how our athletes, professional athletes, have in-season, preseason, off-season, if we're going to be programming a child or an adolescent even, we have to make sure that we take these seasons um, into consideration when writing out their programming. And last but not least, so this is important because our kids forget about this, and even our adolescents, our young kids or adolescents, is proper caloric intake and proper fluid and hydration. It's important for recovery and fuel. So the way I like to tell them is whenever I go over how much they're drinking, um, and they say, not that much, and I have a teenager who's just started lifting weights, or I have a college prospect baseball player who's in varsity and they're not drinking much water, you're not going to sell them by saying it's good to your health. You're going to sell them by saying it can help improve your performance. So it's all about gouging or adapting, I should say, your advice to help kind of stimulate your client's interest or pique your client's interest. Like, oh my gosh, well, if this is going to affect my outcome, my performance, it's in my best interest that I could increase this. And there's also nothing wrong with some sports drinks, right? So I'm not going around recommending Gatorade by any means, but if I have an athlete who's drinking 2.5 liters of water daily and he's a 200-pound male, and I'm like, you know what, this guy should drink some more, I'm telling him that on top of those 2.5 liters of water, I like Pedialyte Sport. I like it in terms of one of the sports drinks. I think it's the better of them. So I'll tell them, you know what, in another liter of water while you're at practice, just dump in some Pedialyte Sport. So it doesn't seem like redundancy for them. It's still pretty much water, just with electrolytes added. But that's how I go about it when I'm doing my consultations in the doctor's office for my pediatric patients who are athletes. I only recommend it to the athletes. I don't just tell a random 6-year-old to drink sports drinks, but there's a defensive lineman who's 200 pounds, who's 17 years old, and he's only drinking 2 liters of water. I tell him to throw another liter in there, or a liter and a half during practice of Pedialyte Sport. And caloric intake, you want to make sure that they're having proper caloric intake for high schoolers and adolescents. Usually during for our competitive athletes, that's not an issue depending on the sport. Um, Gymnasts, cheerleaders, figure skaters, those could be a little bit more difficult. We're going to touch base on that later, but for our baseball players, stuff like that, usually they're housing food nonstop. So it's more so about getting appropriate intake or appropriate nutrients as opposed to adequate intake. So continuing forward with the risk for the AAP, skeletal risk. So linear growth, like we talked about, physical health and cardiovascular health are not negatively affected with proper training and programming. Dynamic contractions of the muscle tendon attachments of the apophyseal areas during active play, sports, or lifting weights can increase a risk of avulsion fracture until skeletal maturity. So big words, lots of big words. What does that mean? Has anybody ever heard of Oshkosh? I'm kind of talking as if this is a live lecture, so can't see you guys raise hands. You guys, this is recording. But Oshkosh, if you guys don't know, it's an avulsion fracture of the tibial tubercle. So right below their knee, right at the top of your shin bone, there's a tendon that attaches your kneecap to your shin bone. And what happens is during puberty, so during a rapid growth, pre skeletal maturity, so puberty, a lot of soccer players will get it, where that tendon pulls a lot during running, jumping, hard hitting, and there's just a bunch of microfractures that form, and you get a big hump on your shin bone, and it causes a lot of pain. So it's not like you broke your leg. Oshkosh, it's very common. So that's pretty much what this is saying. During dynamic contractions, so during a lot of strenuous exercise, you could get Oshkosh, pretty much, which is something that we already know. And safety during resistance training is improved with supervision. Safe training environments are improved with improved ratios. So, and it depends on the level of expertise. So a first-time gym teacher straight out of college teaching weightlifting class, who he himself is a newbie to weightlifting for a class of 30 17-year-old males, it does not seem like proper ratio and proper experience level or expertise. But you could have one high school football coach who has powerlifting experience teaching a class of 15 football players who have good head on their shoulders, and this is what they want to do. So there's initiative. So that's different. The ratios are, there's no standard number, but it has to be tailored for expertise, program design, training age, level of experience, stuff like that. So, pediatric obesity, my experience and what the literature recommends. So, we had that previous quote, which is pretty much saying there's more adherence when you have an inactive patient or an inactive pediatric kid who starts resistance training. It helps with adherence. So this quote right here, programs involving resistance training provide positive options to engage children and adolescents with overweight or obesity in physical activity and may be more likely to create a positive and successful experience for these participants who may have lower levels of physical fitness, poor exercise compliance, and reduced tolerance for aerobic training. So what does this all mean? This is kind of what I got into what I'm doing, why I'm doing this kind of talk here today. When I was at clinical, so this is my personal experience, there was several times where there'd be an obese adolescent or an overweight adolescent coming to their doctor saying, I want to lose weight, I don't know how. And far too often, the the answer to that was the pediatrician saying, oh, well, you just have to eat vegetables and cut out everything you're eating, pretty much eat vegetables, grilled chicken, and, do spin class 5 days a week, or just hop on a treadmill till you can't anymore. And that's simply not correct. Can that be right? Sure, but this is an individualistic approach. If a kid wants to do that, and they're going to do that, sure, great, but that's not realistic. It's not even realistic for myself. So that's what makes resistance training great, especially in this population. So in pediatric obesity, you can't tell a kid who, in this population, a good amount of them suffer from low self-esteem. They have they're going to have trouble going to a spin class. You can't tell them to go to spin class when it's going to be a class that they're most likely going to be at the end of the pack, struggling to keep up with the rest of them. And when you have somebody who already has low self-esteem looking to lose weight, how does that help comply with adherence? It doesn't necessarily. So that's why I like resistance training. And especially with my experience, what I usually do is um, my whole goal is for adherence. So I'm going to hop into the second slide where it's like forming habits are more important than forming bodies. So when I see these patients and, I have my 16-year-old coming in for a regular well checkup, and he goes, Dr. Steve, I want to lose weight. I'm tired of being obese. What do I do? We go over programming, weightlifting, and they get on a standard weightlifting program. And when I follow up with them in 2 to 3 months, I don't even care about weighing them. I don't have them reweigh themselves. I don't care about the scale. Why? Because that's one metric that I don't even care about. It's more important for me to say, how many days a week have you been hitting to the gym? 4 days a week, great. What's your favorite exercise? You like incline dumbbell press? Amazing. So I like incline dumbbell press. What's the heaviest you've done? This much? Okay, great. Well, I'm gonna follow up with you in 2 months. I want to see in 2 months before you come and see me. I want you to PR. I want to see how heavy you could go, um, and have some fun with it. And it doesn't have to be a 1 rep max. I just want to see how far they could go. And in 2 months, I'll see if they're adhering to the program. Are you still lifting an hour, 5 days a week? Oh, great, you are. Great. You hit a PR. Amazing. Are you having fun? You're loving it? Great. And this population, they have a larger body mass. They're going to lift a decent amount of weight for the most part. And it's what I've seen too, where they adhere to the program because they're actually having fun. It's not something that's so high strain on their body. And when you start incorporating resistance training is when, for the previous quote that I had, it could lead to a hybrid training. So after the 4 months, oh, you've been sticking with it for a while? Amazing. Can we add 15 minutes of walking on the treadmill as your warm up? And we just take it from there. So I'd much rather see my patients still going to the gym a year from now than me have been forcing them to go to a spin class where they feel horrible afterwards. They're eating things they don't want to eat and they quit in 3 months. That's not forming longevity. And the whole goal with this is longevity. We want to make sure that they feel comfortable with themselves and confidence. Mental health is very important. So longevity, confidence, these kids, their minds are being molded in this age group of adolescents. And we want to make sure that we're taking care of that and we're causing good. We don't want to cause any harm. Um, my last quote here, I love this one, is be science based, not science bound. So science is ever evolving. And I'm sure Professor Partman will agree with me. So there's a reason, especially in healthcare, where we say the science doesn't prove anything. You can never say this proves this. No, it's highly suggestive. If anybody says that I read this article and it proves this, that's wrong. It's incorrect. It's ever evolving. So that's why we're always science-based, not science-bound. I'll never say this is clear-cut what the evidence says and you absolutely have to do this, and that. No, we don't want to do that. So we want to be evolving with it, and adaptive. Other key parts of importance is mental health. So by age 6, girls begin to show concerns about weight. Specifically, 40 to 60% of school age girls, I'm sorry, report being concerned about their weight or becoming overweight, which is an astonishing large number. And in elementary school aged females, 69% report pictures of female influencing the idea or the ideal image of an ideal body. And 47% of these pictures make them want to lose weight. And this is elementary school. This is not high school. Bullying or teasing about weight leads to increased weight gain, extreme weight control measures, and binge eating. And this last one, households in which mothers are shown to be overly obsessive and focused on weight loss are at increased risk to imitate and develop the same behaviors. So these are all statistics I took from the National Eating Disorders Association. So another big organization. We want to be careful in what we do with our pediatric patients, especially our adolescents, and how we talk to them and the verbiage that we use. So continuing statistics, this is about dieting. So amongst 14 and 15-year-old boys and girls, those aggressively dieting are 18 times more likely to develop an eating disorder. 35 to 57% of teenage girls engage in some sort of crash diet, bad diet pills, vomiting, fasting, or laxative use. And amongst teenage girls, those who are obese are more likely to participate in some sort of extreme dieting measure. So, key points here. And, a couple of these statistics are on girls. I don't want to just focus on girls. These were just the ones that I pulled, but boys do and males do suffer from eating disorders as well. But the key point here is if you have a pediatric patient and you're their coach or you're their trainer and they're a weight loss client, weight loss cannot be the only goal. So their goal could be to lose 20 pounds, but we need something else. Their goal could be, if they're 250 pounds, to eventually get down to 170, but that can't be their only goal, because once they hit that, then what? We become obsessive over this number on the scale, not over other things. We want to set strength goals. We want to set objective goals other than body image and other than weight. We want to set feeling goals. Do you feel more energetic? Are you sleeping better? Do you feel more confident? We want the confidence to come from how they're feeling what they're doing as opposed to how much they're weighing, because we want to try and negate any type of negative side effects when coaching these kids. And that's very, very, very important because it's things that I've seen with people who are 300 pounds lose weight, go down to 140, and they're still not happy with their weight loss, and they cannot, not for anything, try and gain weight to put on muscle. They can. And it's sad to see. And it's something we want to try and prevent from happening as coaches and as trainers and as programmers. So, for the mental health aspect, how do we help? So, in trying to do good, we must make sure we prevent the bad from happening. So, how do we do this? Be careful with your verbiage. If your client is looking for body recomp, health, weight training, this population is vulnerable to verbiage regarding body image and self-esteem. So we want to be careful with the words that we say. The goal, we want to say things like energy, confidence, strength, progress, skill development. If the goal is weight loss in obese patients, make sure the goal is to set good habits more so than to lose weight. The weight will happen, we want to make sure that the good habits stay. And we want to be aware, openly discuss this with your clients, how they feel, their body image, their self-esteem, and don't be afraid to use words like saying that you're proud of them and proud of their efforts. Also, don't be afraid to escalate to professionals or parents if you're concerned about them developing some sort of mental health or eating disorder. So the important thing to know, I'll just give you guys an example. I had a girl who I saw 2 weeks ago, and she went from being very obese to now being in like the 87th percentile or 86th percentile on BMI, which is great. She's 17 years old. She looks great. And or she's 18 years old. She's going to be going away to college, and you, you can't be afraid to tell these kids that you're proud of them. So, I told her first, I asked her, how does she feel? And she says she feels great. She feels energetic. And I was like, do you feel happy and proud with yourself? She said yes. And I was like, how do you feel you look? She said, I feel like I look great. I was like, great. Do you feel like you need to lose more weight? And she said, no, I don't. And I was like, I don't think you do either. I think you look amazing. And I want to let you know I'm very, very proud of you. And the way that you're holding yourself, the way that you're confident in yourself, the way that you're proud of yourself, that's something that you should be, still proud of, because it's really amazing what you did. And this is the type of conversation that we have to open up and have with these kids, because we don't know what's going on at home or at school if they're getting this type of stuff. And we want to make sure that, like I said, if we have this weight loss, we're not continuing with it. There's not this dissatisfaction. We want to make sure that they get that satisfaction from all the stuff they accomplished. All right, so we went over all the data, all the research, all the studies. Now we're going on to the teaching. So on the right, there's this quote, and I love this quote. It's, I fear not the man who has practiced 10,000 kicks once, but I fear the man who has practiced one kick 10,000 times. So this was Bruce Lee. And what does this mean? This means honing in on the bread and butter. You can't learn to do 10,000 things and make it sloppy. It's much better to know one thing and do it very, very well. So for example, you can know how to throw every single pitch in baseball, but if you practice them all at 10%, you're not going to strike anybody out. But if you practice your fastball 10,000 times and that's it, well, people are going to know your fastball is coming. They're still going to strike out because you've mastered it. There's one part missing to this quote though, and that's for the teachers. And it is, fear the teacher who can teach the same kick 10,000 times. So think about that. You're a teacher, you want to teach the same kick 10,000 times. And I'll elaborate that on the next slide. All right, so I'm actually going to elaborate on the kicking stuff on the next slide. But this is teaching and programming key points. So these are the 10 class management skills that are used by the largest martial arts organization in the world. They're great at teaching, and although it's usually used and geared towards group classes, there's a lot for you to absorb even for one-on-one stuff. So the first key point, it is setting the mood and the tone of the class. And it's important to present yourself. This is essentially when you come in saying, hi, how's everybody doing today? Confident, right? So we're saying it loud. We're not mumbling. We're not saying, hey guys, what's up? You guys ready to get started? No, we're setting the mood and the tone in class. Hey, how's everybody doing today? Asking a question. You want to see what the response is. If the response isn't adequate, then you got to ask them again. Hey guys, where's everybody's energy? We want to make sure, hey, come on, what's going on? How's everybody doing today? All right, our second one is create a positive climate. Simple as, so you guys ready to have a good time today? Who's ready to learn and have fun? Notice the positive climate and you're setting the mood and the tone still. So you guys ready to learn and have fun. The third one is to use a personal approach and individual context. So you want to make sure if you're going around through a group setting, you're saying different things to different people. So if we're doing punches in a martial arts class, we're not just doing punches and that's it. We're going around and telling Johnny that he is the best punch. And why does he have the best punch? So we'll go over that. Set direct goals. Class management skills utilized in class to design. It's important to have a goal for the class. So what's the goal of the class? We want to make sure that we have purposefulness throughout the class. And this, like I said, could be for the individual class too. What's the purpose of this session? 5, give direct feedback to each student. So you don't want a kid to feel like he's left out and he's background. We want to make sure that everybody is coming out of that class thinking and knowing that they got better because they got one-on-one education throughout some portion of the class. Reinforce positive behavior. So the one thing that I would love to do, I used to be a martial arts instructor and I was a manager of a school, is if a kid was doing well, I would bring him to the front of the class to demonstrate, and he would do it alongside me. If he had the strongest punches, I would tell him that he had the strongest punches and why he had the strongest punches. So this is what's going to go on later with one of these other class management skills. Giving realistic praise. So we want to make sure that when somebody does something right, we tell them, but it has to be realistic. So everyone responds well to praise, but we want to make sure of like instead of praising a good kick in martial arts, praise what made the kick good. So like I said, I was bringing Johnny up to the front of the class because he had the strongest punches. I'm not going to say Johnny had the best punches. I'm bringing him up to the class. That doesn't help anybody. It makes them feel good, great, but I'm speaking in terms of technique. It doesn't help anybody improve. So why did Johnny have the best punch? Well, he rotated his hand the best and had the best balance, and I could go into detail, but why? Why was it? Why did he have the best punch? And you're going to go over that realistic praise so that way he knows what he did good. Give positive correction rather than criticism. So what this is pretty much saying is if somebody's doing something sloppy, right? You're in tennis camp and you're teaching tennis, or you're programming something for soccer, or you're coaching a soccer conditioning class, and somebody's having a horrible header. You don't just want to be like, hey, your header's not good. That doesn't help. What can we do? Correct praise is what I like to say. Hey man, I love your focus, I love your effort, but your header could be a little bit more on the bridge of your forehead because that's where we drive most of our power from. So I want you to keep that eye contact and make sure that you're going to have that really good strike right at the center of your forehead or the bridge of your forehead. And then that's it. Give him a high five, step back. He does it right. Amazing, great job. See, you followed directions. Boom. That's what we want to do. Praise, correct, praise. So we're giving positive correction rather than just criticizing. Refer to the students by their name. We don't want to say, hey, you. If we don't know somebody's name, we ask. And teach the concept of personal victory. So this is the same thing that I was talking about with the obese clients and the overweight clients. We want to make sure that, or even with the adolescents, like I said, pretty much everybody, we want to make sure there's personal victory because we don't want them to be chasing a never-ending battle. We want to make sure that they know what they did right. All right, so I just whipped up an example of how we're going to teach school-age children in a group class setting. So primarily we want to keep it challenging and organized. Just because they're younger does not mean it should be a free-for-all and it should not be challenging. So meaning kids should not just be running around like there's a wildfire. We want to keep organization, and that's part of setting the mood and the tone of the class, right? Our class management skills. So here's just a quick, simple example. The goal of this class is balance, right? So let's create warm-ups that are goal specific. So if the goal is balance, push-ups and jogging are not the best choice because how does that teach balance to a 10-year-old? Push-ups are not going to teach balance. So let's start with jumping jacks, right? We're loosening up the legs and let's progress. So progression, step 2 is to proceed with an advanced single leg jumping jack. So Something like, they're just going to hop on one leg and use their arms like they're doing a jumping jack. So their arms are moving off their center of gravity, up and down while they're hopping on their right leg, and their left knee is tucked to their chest. And then we'll switch legs. So notice we're warming up, but it's still balance. And three, continue with a single leg hop relay race in a class setting, or if you're in a one-on-one setting, race them. And you could hop all the way down to a cone and all the way back. And you could even put different cones so they have to zig in and out, make it fun. So notice how we're doing, like what Bruce Lee said, we're teaching the same kick 10,000 different ways. So we started with the jumping jack, we went to single leg jumping jacks, went to a relay race, we went to relay racing around with a cone, and you could do it backwards then. Let's relay race backwards. All of this should only take 15 minutes. It's not like we're setting up a million different things. So in a 15-minute warm-up, we just practice balance like 5 or 6 different ways, and the kids are having fun doing it. So keep it simple. Now we're going into the rest of the class. This was the warm-up. Simple. Time them for a balanced foot PR. All right, great. So now let's loose. Now we're good. Let's get started. Let's see how long you guys could stand on one leg. Great. So let's progress difficulty in sports specificity. So if this is a kid who's playing tennis, let's have them hold a tennis racket, balance on some sort of object. So we used to use foam targets. So you could use a foam block where they balance under some sort of instability, and they have to hit the tennis ball back at you, keeping balance on their foot. Simple, but more advanced. And lastly, we incorporate some goal-oriented game. So for a group class, for example, balance tag. You could create any game with tag or any game with dodgeball. So balance tag, for example, we throw those foam pads around, throw a dozen of them on the floor, and if you stand on them with one foot and you don't touch the floor, you can't be tagged it. And once you're tagged it, you're it. So the kids are running around and they're balancing on the objects, focusing on their balance, and the second they go down, try to run another one, if they get tagged, they're it. But the longer they're able to balance, the longer they're able to not be it. It's a game, but they're still focusing on what the goal of the class was, if that makes sense. Another example is bear crawls, right? So we have bear crawls. Let's have kids start with a bear crawl. And then we have a contest, and this is more so for preschool age. Let's have a contest with who could growl the loudest as a bear. So you have a bunch of 5-year-olds now growling and having fun, and then let's incorporate the parents, bring mom and dad in. Let's see who could race their mom and dad, right? Let's do bear crawls backwards. We just did bear crawls 5 different ways, and the kids are having a blast doing it. So this was it's all about who can teach the same thing 10,000 ways. So, you don't have to know a million different things, just know how to do one thing a million times, and you'll be successful in teaching kids because they're going to love it. As long as you incorporate the 10 class management skills and you have a lot of fun, bring a lot of energy. So this was just a template that I quickly whipped up for a single workout. So the goal of the workout is distinguished, right? Goal-oriented warm-up, goal-oriented drills, and are we hitting the goal? So we want to make sure we're not saying that at the end. We don't want to be at the end of our workout and be like, you know what? We never got to where we wanted to. We want to make sure that we're hitting the goals. Then some sort of goal-oriented game or test. But with the test, we want to make sure that there's respect to overuse. So if, like the test is power, we want to make sure that, or if the goal was power, we want to make sure that the test isn't power. So we don't want to cause any injuries. But for example, like if in martial arts school, with the punches, the test might be a board break, right? So it could be something fun like that. And all of this plus using the 10 class management skills. So the conclusion, the science, after years of research, it's accepted that children, adolescents can increase strength with lowering injury rates if resistance training is well supervised. There's an emphasis on technique. This is all by the AAP. Early studies successfully demonstrated significant strength gains in children, a lack of injury with proper technique and supervision, and an abundance of studies showing encouraging gains from youth resistance training. Viewpoints are fluctuating regarding integrating resistance training into physical education, youth fitness, and injury reduction programs. So in gym class, that would be amazing. Prior concerns concerning resistance training concentrated on what would happen if a child lifts weights, but now the studies are concentrating on what would happen if they don't. So now we know it's good. So they're more so looking at the negative side effects of not lifting weights. And the accessibility of research supports resistance training in youth to enhance strength, to improve performance amongst a variety of skills and sports while lowering the risk of injury. Previously, concerns revolved around injuries due to resistance training, and now concerns are focused on injury and other adverse events due to the lack of adequate strength to keep up with training demands. So this is just a conclusion on resistance training and how it's good for pediatric patients. And pardon all of my grammatical and spell check errors on this one. So conclusion, let's talk. The other one was science. This one's just me talking. Kids are fun to teach, but we got to remember our main goal is to promote growth, promote fun, and do no harm. So we want to make sure that we let these kids have fun and we let them learn to compete while promoting mental and physical growth and being positive role models. So the goal is always to do no harm on anybody in terms of patients or clients. We want to make sure we have the best for them. So that's where we talked about the mental health and the verbiage, and we want to take that into consideration. And we want to make sure that we have fun with it. We want to be positive role models. I'm sure all of you guys could remember having a coach or a teacher that you looked up to. Well, now it's our chance to be that coach or teacher that these kids could look up to and have fun with. So make sure that you have fun with it. Make sure that you could be a role model. Make sure that your goal is to promote all the good things, but also do no harm for your kids. So just a quick summary of what we learned. So large national organizations all recommend exercise for children, adolescents, including resistance training, including weightlifting, as long as there's supervision. And we went over the 10 class management skills, teaching the same thing in several ways, the pros and the cons to resistance training in youth, mental health in youth with programming and coaching, and the approach to obesity. So how young is too young? Well, you'll probably run into this question by some people, and this is my answer to that question. This is my 2-week-old daughter, Francesca Rose. So that's her holding her little dumbbell rattle, which is 1.5% of her body weight. So how young is too young? Well, to me, as long as there's proper supervision, there is no correct answer. Um, my goal is to make sure that these kids learn in a safe environment and a happy environment, and we do no harm to them, but we provide them with good role models, we provide them with a good learning environment, and with setting good longevity and good habits with adherence. So this is my answer to that question. My little daughter Francesca and I matching with our West Side Barbell attire. And here are my references. I hope you guys were able to learn a lot. Once again, my name is Steve Delos Rios. If you guys, have any questions or want to email me, you could email me at stevedelosrios@gmail.com. My first name is on the first slide. So, I'm here if you guys ever want to talk about these questions or have any questions, or if you want to discuss this presentation by any means. I hope you guys were able to learn something. I had fun teaching you guys, and good luck on the rest of your semester.